Hi, this is Jane Chen with Medical Science Liaison Institute. Today we're going to talk about MSL career development and specifically focus on the nature of a field medical science liaison career and why is it so tough to find a good career development ladder for those talented MSLs that you want to retain at your company. If you are an experienced MSL, you are probably no stranger to a lot of these issues that I've discussed. And if you are an aspiring MSL, these are definitely very important points that you should consider before entering this career so you know exactly what to expect. Since medical science liaisons are field-based, they are often shielded from a lot of opportunities that may be afforded to corporate employees. There may be openings in other functions that MSLs can be suited for, but they never hear about it because they are actually not at the company. They're out working in the field. MSLs often feel stifled in their career and they feel as if they either have to go up a ladder as MSL managers or move along a management track, or they stay as individual contributors as MSLs. Very few of them know what other options there may be in a life science company that may be suitable for them. So one of the things that perhaps MSLs can do, and certainly MSL managers can do, is to really scout certain opportunities that may be suitable for developing MSLs that may be in-house. I do know that some companies do rotations where MSLs are brought in to do a functional rotation for a certain period of time, or they're given specific collaborative projects that they can do with an internal stakeholder and that allows them to get exposed to other functional skills that can eventually lead them down a different career path with the same company. I know that it's very hard to believe in this day and age that there are some companies that still do not understand what MSLs actually do. You know they're out there. It becomes incredibly difficult if your HR partners who are responsible for developing and codifying these development ladders in the company, if they don't really understand what it is that you do, it's really difficult for them to partner with your executives to then formalize a career development ladder for the company. Or what happens is they usually default to the, oh, okay, then let's just give them more money. So instead of a career ladder, it becomes almost like a salary ladder. Now, I know financial incentives and financial rewards are a major component of this job, as for any job, but money is not the only driver for MSL retention. There are a lot of other drivers for MSLs who stay long-term at their companies, and it goes beyond money. A third factor is bottleneck. These management positions are hard to come by, including MSL management positions. They're already pretty rare. This is one of the reasons you find so many tenured MSLs. If they have quite a few years under their belt, if they have worked with big pharma companies, eventually they tend to go to a smaller startup that's riskier, but they also are exposed to more advancement opportunities if they get in from the ground level. What I have found really interesting is a series of inherent conflicts that happen with medical science liaison professionals. If you're not willing to move, then you do know that you're limited for certain growth opportunities that require you to move. Another conflict is conflict of desire. So I know that there are a lot of MSLs who really want to be developed, but when I speak with them and I say, what does it mean for you to develop as an MSL? Sometimes they can't really tell me. I do know that companies have different rankings of MSLs and they give you different job titles. There are some companies that give you associate director positions even though you have no direct reports. This is really not enough because if you remember from the first web episode where I talk about job titles, it doesn't really say much about what it is that you do on a day-to-day and the specific skill set that you either grow or expand in that new position. Because chances are, in order for you to even get a title change, you probably have to possess about 1/3 to maybe a half of the responsibilities required of the job you wish to go into. So one of the ways that you can think about is, what are some of the skills I want to grow? How can I grow it? And you know what? It doesn't necessarily have to be within your MSL job. This is one of the reasons why I stress an importance of a balance of identity in your work and in your life. What I found really interesting as a conflict is the conflict in expectations. When I speak with MSLs, what it is that they expect their managers or companies to do better, they always have a ready answer. I wish my manager can do better about growing me as a professional, about providing me advancement opportunities or growth opportunities. When I ask them, if you are a manager, how would you do things differently? And a lot of times the MSLs can't tell me. Part of the reason is because we are not exposed internally to the company as perhaps some executives would be exposed to internally. So maybe we do not know what the options are, and that's one of the reasons why we cannot answer. I think the problem is sometimes we expect managers and employers to deliver on things that we ourselves probably can't deliver if we're in their position. And it's not because we don't want to deliver, it's because, again, going back to the nature of the beast, these are field-based positions. There are certain limitations that are trade-offs to very valid rewards that we gain as medical affairs professionals.